Yeah, good morning to the session again. I've
Good
shared it with,
morning.
yeah. Um, Hoping for others to join, but I'm not sure, but we should be starting our session. I hope you can hear me clear and I'm sharing my screen. I hope my screen is visible as well. So, we had studied till the patients and person-centered care. Okay, that was slide 17. And we had talked, we were about to talk about an example. So welcome to the session again. It's working in health and social care. We are doing this first learning outcome, which is understanding person-centered working. Okay. And we were going to talk about this case. Um, just share it with you. Just give me a minute. So we had talked about Malcolm. So Malcolm is a 27-year-old inpatient. I'm not sure if you've done this this case or not. I had shared with you earlier. So he was recently he met with a car accident and he had to undergo surgery for both his arms and that suffered severe injuries during that crash. And he needs to remain in hospital for 2 more weeks before discharge. And this means he will rely on others for a significant amount of his daily care. Okay. And Malcolm and his nurse discuss what options they have for fulfilling his needs and his wants. Their needs, like he needs to bathe, he needs to pass time in a productive way. And because he's just 27 years old, Malcolm would rather not spend 2 weeks watching TV in bed. He says that he enjoys reading and spending time with his girlfriend who visits him every evening. So, what would you do in that case? That was the question that I had to ask you. So, what this nurse did was that there was a care plan that was devised together. So, for bathing, the hospital normally helps patients shower in the morning. However, they agreed to let his girlfriend assist him in the evening with his personal hygiene routine. And Malcolm's girlfriend also sends him e-reader, um, for his audiobooks. And this is a suitable alternative to books, given his physical condition is not too good at that time. The nurse also agrees to help him set it up and put up headphones when he would like to listen to it. So it's tailored according to his requests or his needs. The nurse adopted an effective approach to person centered care in this example. She also talked through options with Malcolm and sought his input. She allowed flexibility to accommodate his wants and needs and agreed to help meet these needs in the hospital on a daily basis. As a result of this, Malcolm's stay or time in care will feel much less strenuous and he will feel cared for both physically and emotionally. So he has a personal touch there also in the form of his girlfriend who is allowed to do stuff with him. Um, and otherwise, whatever his needs are, they're all being fulfilled to a great extent with this person centered care approach. So we had talked a bit about why person-centered care approach is important, a bit revising it. So what happens when you have a person-centered care approach? The patient will feel more comfortable and confident in your service. You will meet their emotional, social, and practical needs. You can support those who may not be able to directly communicate their wants and needs. We had talked about some difficult learning disabilities where there is difficulty in communicating their needs, and it improves their independence as well. Now we come to safeguarding, which is everyone's job. So hope this is clear and you don't have to strain too much. I'll make it a bit bigger so that it's clearer for you now. Okay, so What is safeguarding and protection in person-centered care practice? So safeguarding is a term, how do we define it, that encompasses a wide range of measures and principles that ensure that basic human rights of individuals are protected at all times. And more specifically, safeguarding aims to make sure that vulnerable adults, young adults, and children can live their lives free from abuse, harm, and neglect. Okay, and safeguarding and protection plays an important role in person-centered practice, like service users values, their preferences, their beliefs, and life experiences are not being respected, and this may lead to an emotional abuse. For example, not considering religious beliefs, life history, likes and dislikes, etc. But in the case of person-centered practice, the service users have to be treated as a unique individual with individual values, preferences, beliefs, and life experiences. Furthermore, by not allowing making choice of food or getting out of bed, it's again an act of abuse. It's neglect and abuse as well. You're neglecting their preferences and you're abusing their rights. And it is very important to respect their choices. By protecting patients from danger and timely medication without discrimination and maintaining privacy along with active participation in decision making and independence are integral aspects of person-centered, sorry, that's a typo, person-centered practice. For instance, a user of a service or a service user may share certain life secrets with a care provider. They might be just telling and making themselves a bit lighter by talking about something. And they may belong to a minority group and they've had a struggle, let's say, and might be getting government help because of lack of funds or whatever that they're facing. However, by providing care without disclosing such things to anyone, safe safeguard and protect the service users. So, what's the duty of care? You have a duty of care to your patients or your service users and your colleagues. Safeguarding is everyone's business, as I said earlier. The Health Professions Council standard state that a person who is capable of giving their consent has the right to refuse treatment, whatever treatment that is. You must respect this right at all times. You must also make sure that they are fully aware of the risk of refusing treatment, particularly if you think there is a significant or immediate risk to life. Duty of care can be said to have reasonably been met where an objective group of professionals is considered. Um, so, what is safeguarding adults and why does it matter so much? Why is it so important? So, safeguarding adults means protecting a person's right to live in safely, free from any abuse and neglect. The CARE Act requires that each local authority must make inquiries or ensure others to do so uh, if it believes an adult is experiencing or is at risk of abuse or neglect and they're vulnerable, then you make it even more important. Um, and an inquiry should establish whether an action needs to be taken to stop that abuse or neglect, and if so, by whom? Who has the responsibility to stop that action or to enforce an action? Set up a safeguarding adults board. Arrange where appropriate for an independent advocate to represent and support an adult who is the subject of a safeguarding inquiry or safeguarding adult review, where the adult has substantial difficulty in being involved in the process and where there is no other appropriate adult to help them, and cooperate with each other of its relevant partners in order to protect adults experiencing or at risk of abuse or neglect. An adult who is at risk is any person who is aged 18 years or above and at risk of abuse or neglect because of their needs for care or and it can be support as well. Where someone is over 18 but still receiving children's services and a safeguarding issue is raised, the matter should be dealt with as a matter of course by the adult safeguarding team. Safeguarding training is very, very important in these circumstances as it offers health and social staff guidance on interacting and establishing connections with their patients. So, even, for instance, if you're in a care home environment, if there's a patient there, person-centered care
Yes.
might involve something as simple as arranging old family photos on a patient's desk, just to make them more comfortable, more homely, um, more close to home. Person centered care would also involve like any personalized service that provides familiarity for those in distress. Some flowers that they like, that those can be placed there, something that gives them peace. Earning a person's trust plays a huge part in their response to prolonged treatment options. Person centered care and specialized safeguarding training also enable health and social services to remain flexible without a one size fits all care plan, continuing between services, and can improve, allowing patients to receive care on their own terms. Health and social care professionals, they continue to manage the patient's treatments, but the patients themselves become uh, far more involved in the process, which makes them give them all the benefits that they need. There's some
Okay.
principles of safeguarding. So we'll talk about them. Safeguarding is a very, very important issue. I'll tell you where I um, had a safeguarding concern and I didn't pick it up. Um, we have our, as I told you earlier, I don't know if you were there, um, we have our regular, like every organization has their um, reviews, their teaching reviews. So I'm basically a teacher, so I was being reviewed or assessed by another senior educationist. And what I missed or what I should have picked up on was that there was this student who came in late in the class, and she had come with a child. Okay, I think the child
Mm,
might be 8 or 9 years old, and because I was under stress because I was being reviewed by a person who I have not met before, and although it was planned, but this child coming in was not planned at all. Um, and I did not realize um, till later, towards the end of the class, that there is a child here, because I was so engrossed in my own teaching. And
okay.
and later on, the child that wasn't a good day for me. The child put his head on the desk where he was seated, and he had a fluid bottle also in his hand with some solution. So I felt he was not well. And later on, after the class was over, he threw up. He was not well at all. So it was a safeguarding issue that I should have just ended the class over there, paused it, not ended it, just paused the class. I had to go to that student and I had to ask, what is the issue? Why has she come with this child? Take her to the side and talk to her about it and clear that matter, because children are not allowed in an adult classroom setup. And
Yes.
that is a safeguarding. I'm just giving you an example, a life example, that you should pick these things if you see
Okay.
such issue. So safeguarding is not always going to be conflict. It's not always going to be um, an ugly situation. It can just be this simple situation where a child is not well, or child is not allowed there. Even if the child is well, the child is not allowed. It's a university where the child cannot come. So just giving you an example. So yeah. So
Okay.
yeah. So six principles of safeguarding are empowerment, protection, prevention, proportionality, protection, partnership, 1, 2, 3, 4, 5, and accountability. So we'll talk a bit about all of them. So empowerment means helping the vulnerable people and or their family and friends to make their own decisions about how the safeguarding issue might be handled. Okay, so that the patient, the people who are vulnerable, let's say there's a patient who has Down syndrome, how do they you help them make their own decisions, teach them how to make their own decisions about safeguarding issues. So if they've been neglected or if they've been abused, how do they raise those concerns? So this is empowering them. Prevention, the number one function of safeguarding should always be to prevent abuse or any harm or neglect from occurring in the first place. For instance, by having a good security policy on the premises. Proportionality, so any response to a safeguarding issue needs to be done with care, sensitivity, and proportionality. So if it's at a higher level, the safeguarding issue needs to be raised at a higher level. And if it's lower, then lower. So it depends upon the intensity or the need of that situation. Protection, those who are in need of safeguarding protection should always have it. However, they might be vulnerable and whatever issues they face. So whoever's, like in my case, there was a child. That child should have been safeguarded. That child should have been in a safer place, not in a classroom setup, and especially when he was not well. Um, so that's how we protect the child or anyone who's vulnerable. Partnership. So safeguarding is something that needs to involve various individuals and parties. Sometimes you might have to involve the police, but in my case, obviously, the police should not have been involved. But if you see abuse happening in front of you, you should not accept it. Even if you wouldn't want to go and intervene, if there's a husband or a wife abusing the other person or the other partner, um, it's none of your business, but you are there for safeguarding issues. So you need to inform the police, obviously, so that or domestic violence departments for this, because that is your duty. That is our everyone's duty. You don't prevent this from happening. There is going to be another that there is going to be another death, and accountability. So transparency is very important in safeguarding, and all professionals will need to know exactly what is expected of them. Okay, so it's everyone's accountability. What are the benefits of positive risk taking for individuals accessing services? What are positive risk taking? We were also talking about positive risk taking, that positively that person can be involved in activities where they're taking risks but in a positive way, and that risk is not um, so large that it could harm them. So it's just a risk. Like for instance, there's a person with a disability you're treating, and you're asking, or there's a person who's a female who's had a cesarean section or a surgery. The next day you ask her to start walking on her own. That is positive risk taking. You don't want her to stay in bed because those stitches are not going to be healed very quick. However, if they start walking, that practice can make them heal very quickly. So, according to Frontier Support 2017, following are the benefits of positive risk taking for service users without compromising on their safeguarding and the duty of care. Rather, it is about taking risks prudently. So, positive risks build confidence of the service user or the patient. For instance, making a person walk after the operation, just as I said, they will develop new skills. For instance, a special child learns to hold a puppy. Further, it demonstrates the consequences of wrong decisions and promotes to learn from mistakes. For instance, mentally ill patients may be given freedom and might do something that may harm their physical body, and they can be patient. And can be patiently and and in a loving manner, they can be made to understand not to repeat the same. So if there's a person who is who inflicts self-harm on themselves, now you're not going to be judgmental. You're going to talk in a very loving manner that they should not be doing it. They won't listen to you, obviously, but it's a process. Okay, so you need to hear them and you need to make yourself be heard as well. On the other hand, giving freedom to do some activity and the patient is able to perform the activity successfully, This act provides satisfaction. For instance, a person who is first time walking after a leg surgery without assistance, that's going to be a really happy moment. In the end, it also builds self-esteem and makes the person may develop the ability to make their own choices in other spheres of life and the ability to take risks positively. What is positive risk taking again? It involves recognizing that there are risks associated with many aspects of everyday life and supporting individuals to take appropriate and calculated risks and not living a life that is completely free from risk. So, what are the benefits? That's greater independence and autonomy, opportunities to participate in relationships and activities, opportunities to learn and gain experience, increases their self confidence and their self esteem, and supports them to feel in control of their lives and to make their own decisions. And they have a lot of respect for you, and you have a lot of respect for them. And that respect is mutual, and it gives them the confidence which they need in you. Um, this is very important, this concept. So we're going on to analyze how um, the 6 C's of care underpin person-centered care practice. So to protect vulnerable adults from mistreatment and improving their quality of life, caregivers must follow the principles of the Care Act 2014. What does it imply? The principles aim to emphasize that everyone in care is a human being, and they have their own distinct wants and needs, and they define how important it is to involve a service user in the process of assessing their safeguarding needs. When you follow these 6 principles, you increase the autonomy of vulnerable adults, and you are in turn enhancing your commitment to delivering the best care you possibly can. So, what are the 6 C's? They're all obviously starting from uh, C. And what are they about? So, caring defines both professionals, both the profession and the people who are involved in the profession. More important, it is to remember that people receiving care will have different needs and expectations at different stages of their lives. And so it is necessary for workers to continually, adapt their thinking about what quality care is. So the first is compassion. So the first is care, obviously. Then you have compassion. What do you demonstrate? How do you demonstrate compassion? So a good phrase to think of here is that compassion is intelligent kindness. And this means treating people with empathy, patience, understanding, and consideration. For all service users being treated with compassion, it makes a huge difference to their care experience. Competency. So, this describes how able you are, your skills, and your knowledge. And of course, this covers an understanding of everything that you're going to do with the service user, including both their mental and emotional health and their physical condition. It is also meaning that you have a knowledge of all available treatments and you're making the right choice based on research and evidence. An important point to remember about professional competency is that it changes and evolves throughout your career. So, your competency must be continually nurtured. You need to keep learning and practicing in order to maintain the highest standards. Communication is very important in the 6 C's. Of course, it's very important in anything. Communication skills are very important in lines of your work, particularly. In health and social care, you need to think about how you adapt your communication to different situations and different service users, and also think about how individuals will have different ways of communicating with you. Modern care, as you already know, and support is built around personalized or person-centered approach. You can put the person first. If you don't, you cannot put the person first if you do not listen to them. So you need to listen to them. Okay, that is a big part of communication skills. And you and communication skills also extend to the way you deal with your own colleagues, your peers, as sharing information and keeping clear and accurate the records of are both essential components of high quality care. Courage. So, having courage is very vital in a profession where you might have to make very difficult decisions or to support people going through challenging experiences. Now, if you don't have the courage, you're not going to have the ability to speak up and voice your concern. You're not going, if you're not going to have the courage, how are you going to support others? Okay, so that amount, there is
Yes.
and if you think something is being done unfairly or incorrectly, you are now at a position where you need to raise your voice. You have to have the courage to do that. Commitment. So maintaining all of these standards and values takes personal commitment and a lot of dedication. You need to show commitment to each individual in your care so they receive the best support. You also need to show commitment to continuously improving yourself and the overall care experience for all service users. So that's about this six C's, sorry. And when you follow the
Yes.
principles, you too place the vulnerable person's well-being and needs at the forefront of safeguarding processes. These will always help you directly involve the vulnerable person and any nominated people who can help reach decisions in the vulnerable adult's best interests. And you're managing safeguarding concerns and care plans as well. So the six principles of the Care Act are again empowerment, protection, prevention, proportionality, partnership, and accountability. We've talked about them earlier. A bit about
Yes.
what concerns you may have. So, abused or neglected adults, they're often silent, so they won't speak. They're silent victims during safeguarding concerns, which often means that the caregivers make all the decisions while the service user has little or no involvement because they will not speak. Okay, because of different reasons, because of fear, because of whatever reason. The Care Act principles aim to eliminate such a detached approach where you're doing things and you're relying on that person to speak up, but that person does not have the ability to speak up. Let's say it's a child, that child is fearful. What do? You can't just stop care there. You have to do something about it. So that makes that makes it these situations difficult. So what has been done now, there's the Care Act principles that aim to eliminate such a detached approach where you're only relying on the patient and the patient is not able to make a decision for themselves. When you follow them, these principles that we had just talked about, these six principles of the Care Act, you're actually empowering vulnerable adults to take an active part in safeguarding processes so they receive the most appropriate care and feel in control. Empowerment encourages you to support vulnerable adults so they can confidently make their own decisions and give informed consent regarding their own care. To effectively empower vulnerable adults, you should always assess what provisions, if any, they need to reach decisions confidently. Provide information in a straightforward and jargon-free form, so you don't need to use jargons. You might know of a lot of jargons. No, they're not required here. Ask questions relating to changes in their safeguarding or care plan. And work together with an advocate if wherever it is necessary. Protection. So, to fulfill this principle of protection, you should support and represent those who are in greatest need. Aim to provide service users with clear, simple information about how to recognize signs of abuse and when to come for help. Respond immediately to concerns and take action to liberate a vulnerable person from a dangerous situation. So, nip in the bud earlier. You should know how to contact the appropriate authorities and follow suitable safeguarding procedures so the situation is handled quickly and you don't exacerbate existing risks. Prevention is always better than cure. So you follow the preventive principle. You must be proactive to stop safeguarding concerns from developing in the first place. Okay. So prevention is one of the most critical principles of care. Even after being freed from neglect and abuse, a vulnerable person may still suffer from lasting physical or psychological damages. So it is your duty to preemptively, excuse me, protect vulnerable adults to reduce long-term harm. Safeguarding training is the best way to promote prevention, and it teaches caregivers what the signs of abuse are and gives them the confidence to report suspected issues without putting the vulnerable adult at further risk. Proportionality refers to ensuring you utilize preventative measures or respond to a safeguarding issue in the most unobtrusive way possibly, and take into account the level of the vulnerable person's needs. Don't apply again a one size fits all response. So tailor it according to the individual. Make your safeguarding processes proportionate. So the higher the concern, the higher the safeguarding issue goes. Involving the vulnerable adult when making decisions at all times, they can give you input on what actions in their mind have the least impact on their quality of life and dignity. Reacting proportionality could require you to take small yet significant steps to handle an issue. Trying to tackle a large issue all at once can overwhelm the person. Now, partnership, you need to work in partners. You can't do it on your own. So you need to inform authorities. Local groups should collaborate and share information to reduce duplication or contradictory responses. So you're making a decision, and then there's another group that's making a decision opposite to it. That shouldn't be there to hinder the process. Um, Also, remember to protect personal and sensitive information about people to comply with the Data Protection Act. Only share data if you have permission from the person whom it's about, and only when necessary. Accountability. So when you're transparent, safeguarding practices become clearer. So whenever you have vulnerable people, you have a nominated individual who's there to support them and about for their decisions that you make or changes you consider in the interest of safeguarding. At any given time, the vulnerable or the nominated person should understand the role of everyone involved in the care plan and should be able to contact them if need be. Also, communicate clearly with your team, support channels, including local services that work together with you and local authorities as well. Update them with new findings and progress where relevant. Remember, if you believe a vulnerable person is at risk and they give you consent to disclose, you have this civic duty to report the matter to the appropriate authority. Securely hold any evidence that is available and keep the vulnerable adult safe. Now we come to the last bit where we analyze why it is important for health and social uh, care workers to demonstrate person-centered values throughout their working practice. Very, very simple. So it's a key benefit of person-centered care is that it can help meet the person's the person that you're caring for, their emotional, social, and practical needs, and ensures that they maintain a high quality of life and feel comfortable and confident in your care service. The client will trust you. Whatever you do, they will know that you're doing it in their best interest, which makes the situation easier for both the parties. Patients are more likely to stick to treatment plans and take their medication if they feel respected, involved, and in control. This relieves the pressure on you and the burden on your healthcare service, such as repeated checks and wasted medication. Person-centered care supports people to develop the knowledge and the skills and the confidence that they need to more effectively manage and make informed decisions about their own health and healthcare. It is coordinated and tailored to the needs of the individual. It is important for healthcare because patients are more likely to stick to treatment plans. They will adhere to treatment. They will take their medication once you take them on board. Hospitals in the UK are extremely strained, so we don't want excess. We can't do excess in excess for patients, which we used to do before. So we need to make them more um, handling their situation on their own So, and even in emergency situations, when the person-centered care improves patients' understanding of their condition, and when there's a need for an emergency service, when you're making them more uh, what do they say? You place their health in their own hands. Not completely, obviously, but you supported that. Everyone will feel happier and more positive. It's a time and cost efficient plan. So person-centered care and support plan. So each person's needs and choices will be unique. So you need to make a care plan according to the person's unique needs. And so we'll see this table. So what the traditional care planning was. So there was this earlier. I'm not going to read through all of it. I can just give you this example, which you can do uh, at your home. We can talk about this example when you come and share this. Um, I'll appreciate if you could just mark your attendance. We're starting the second learning outcome. We might not be able to finish it, but I'll just start it. I'm sharing this example with you. Just have a look at it. And
Okay.
next weekend when we meet, we can discuss this. So yeah, a bit about this also. What was traditional care planning, where the professional assesses the person's needs, whereas person-centered care, they're involved. That care provider is involved in all the steps with the service user, and this is in their best interest. Care planning, in the traditional care planning earlier, it followed a medical model of disability, whereas care planning follows a social model of disability in when it is considered as person-centered. There is focus on what the person is unable to do in a traditional care planning, whereas in person-centered care, there is more focus on goals and aspirations what the person would like to achieve within their care and support. Um, then initially it was a static view of the person's ability or capacity, and the professional writes the care plan with little or no input from the person or their representative. Emphasis was more on protecting the person from risk. The process took place when it was convenient for the professional, early or late hours, whenever the professional was finding it easy. And power was with the professionals earlier. Now, what happens is that care planning explores potential for change, opportunities to develop capacity and ability. The person is supported to express their own needs. So, this has now changed. Okay, so the plan is made together. A copy of the plan is made available to the person or their representative. The emphasis is on safe care that respects a person's rights to take risks that they understand. The care planning now, the conversation that happens, it takes place at the time when the person is most or more likely to have the capacity, and power is equally shared. Whereas initially it was most of the more likely the professionals who had all the power. So these are some of the references for this learning outcome. You can have a look at them. They'll be shared on Moodle with you. So that's about the first learning outcome we've just completed. Um, Now coming towards the second learning outcome, just give me a minute.
Okay, please.
Yeah, I hope you can see my screen again. So this unit will talk about understanding the use of effective communication. Okay, so it's one of the C's in care and person-centered care. So why is it important, or why we are going to understand. So the indicative content, we'll cover all of this: one-to-one groups, formal, informal, between colleagues. What are these different sorts of communication when we will work within the agency, multi-professional working, etc.? What are the different types of communication? So there's British Sign Language, you have formal, informal, you have written communication. These all communication ways of communication. When are those? Which one do we use and when do we use it? Data protection, recording, reporting, storage, confidentiality, sharing information, use of information, stating purpose of information, when to share information, and who with safe storage. With who do we have to share the information? The purpose of this information, level of risk, who information is shared with, the safeguarding and content of information. And then lastly is staff training, assessment of need, preferred methods, etc. We'll talk a lot about all of these. A bit about key terminology. So what is effective communication? So effective communication, as the name suggests, is it has an impact. And you're working with the care workers and people in between that communication, and who use care services to form good relationships and to work well together. So people communicate most effectively when they feel relaxed, they're able to empathize with the other person, experience warmth and genuineness in a relationship. Effective communication also requires the care worker to develop and use a range of skills, abilities, and communication techniques. So these are some of the important aspects. So how does communication work, the process? So there is a sender, like I am communicating with you. So I'm the sender of a message, like I'm talking. So you're receiving that message. Okay, so
Yes, ma'am.
in between we have encoding. So I send a code to you. For instance, I'm speaking to you. There's a whole process in it. There's a whole language in it. You're getting those messages, and you are processing that information, or you're decoding that message, and you are the receiver. Okay, and then it works best when there is feedback. Okay, so you're saying yes constantly. So that is a positive feedback for myself, that you're hearing me well, you're seeing my stuff well. So that makes me more confident that whatever I'm speaking, you're understanding it. Okay, so this is how the process works best. Um, thank you for the listening. And effective communication, results from all of these. So active listening, there's some non-verbal communication which you can only see. There's clarifying messages that makes effective communication even more effective. Eye contact helps a lot. Empathy and tone, pace, and content. So don't go too fast, because you don't know the other person is grasping whatever you're saying or not. Appropriate proximity and your facial expressions matter massively. Even if you're distressed, the patient should not see that, um, because you don't know you have a vulnerable patient, and if you're distressed, you're trying and taking them out of that distress, which I think sometimes it's very hard for a service provider, as us, as a doctor also, I feel, or as a nurse, or as any service provider would feel, that it is a very big challenge for us, that whatever we are going through, we just need to mask ourselves and represent ourselves in the best possible way, to have a patient who has challenges themselves. So we need to take care of ourselves in order to face those challenges, and even to support those challenges. Just a thought. So effective communication also requires that the care worker develops and uses a range of skills, abilities, and communication techniques. Again, language is very important. So describe the role of communication in health and social care. We won't go too much beyond just 2, 3 more slides. So healthcare providers, they interact with patients with physical or mental ailments, and social care providers interact with people who are vulnerable and may have mental and physical or mental ailments, along with the interaction among health and social care providers. Communication is considered effective only when everyone within the health and social care setting, like you include the service users, family members, and care providers, they're able to receive, understand, and respond to the sender. Uh, so I'll go towards this more important bit. So, whenever you have the ability to listen and explain, it has a positive impact on experience of care, and it leads to satisfaction. Just as I said, I feel satisfied when I'm lecturing. The service users and family members feel empowered when you're having a good communication with them. Again, as language matters, so if you have a good interpreter, it relieves the service user and their family members as well, because they can understand you better. So, however, the messages should be simple. They must be clear and transparent from health and social care providers to service users and their families. It may also improve the relationship between you guys, and colleagues are also able to develop better relationships and work as a team. So, if everything is clear, it becomes easier for people to work together. There are conditions, however, that may lead to provide and make other person understand the information. For instance, and then there's brain damage, a language barrier, limited literacy. So you need to work on those situations. How would you work? Whether the person with a stroke condition, how would you communicate with them? Maybe through sign language. Therefore, health and social providers need to develop communication skills. They need to be trained. They need to have those tools and techniques that may be deployed. For instance, a translator, pictures to make the other person understand the message. Care workers use different forms of communication during their working day or night, and these include verbal and non-verbal communication, all sorts of listening strategies. They give or receive information about the care that is being provided for an individual. They provide emotional support to an individual or a member of their family. They carry out an assessment of an individual's care needs. Now we go on to explain. I think this is the last set of slides. Just let me have a look at British Sign Language, human aids. I don't think technological aids. Yeah, we'll just do this. Barriers is another set of things. So slide number 10, hopefully we'll just do till this. So a bit about what are the different media of or methods of communication used in health and social care setup. So verbal communication, you're talking through telephonic conversations, you're using a language rather than medical terminology. So it makes it easier for the service user to understand. Non-verbal is positive body language. You're making gestures, you're having a smiling face, appropriate eye contact, which is so important. Just yesterday, I was at a store, and we had a very bad encounter where there was a woman at the till who was serving us, and I don't know, she was annoyed about something, but it was very offensive how she spoke to us and how she spoke to us in front of our children. So she might be having a bad day, but we might be having a bad day as well. But the gestures that she kept making, and it was really, it made me not wanting to go back to that place or to go back to that person again.
Mhm.
So you imagine if you're a care provider,
Yeah.
uh, if you have a bad day and we like that person was serving me, I was a service user, I was like a patient, I was getting treated from that person. But that the even if that encounter is, it lasts only 1 minute, that 1 minute needs to be pleasant, as much as possible. It's hard, but it is possible. Yeah, so but
Yeah.
it gives you lasting memories. Now I will never want to go there, with my child, especially because they might
Mhm.
have to face it again. So it's hard, but it is possible. So we can make a difference if everyone tries and makes a difference. It's going to be a better world. Um,
Yeah.
yeah. So non-verbal communication is very important. Verbal, written communication. So keep written records always. Formal communication and preparing reports they have to be clear and written, good writing. Written communication is being used in health and social care sector a lot. British Sign Language. So when you have people who cannot use, they're deaf or blind, they have other disabilities, you can use that. Artificial intelligence agents are developing technology that enables blind to see to a large extent, which is wonderful. However, it is important to understand that deaf and blind people develop communication skills over a period of time, and they may not have the resources or able to adapt to willingness to adopt new technologies. They're used to their own languages. Now, human aids, so you have interpreters for communicating in different languages. You have translators who translate what is written in one language to a second language. So from English to Hindi, for instance. Signers who use British Sign Language, for instance. Then there are symbols, signs, and objects of reference. So you can use different symbols, for instance. Using images enables people who cannot speak or uh, sorry, understand a spoken language like English to communicate. You may need objects of reference such as jewelry, toys, clothes for some child who is not willing to have an injection. You may use a cuddly toy. Or for a child, an older person may treasure their photographs. You can use them to talk about things more comfortably. Technological aids, so electronic communicators, hearing aids, video phones, these are all very in nowadays. Many non-disabled people also use technology in the form of mobile phones, text messages, and emails to communicate with others. Websites, you have different websites, social media. They're examples of technological aids that promote communication between people. I think that's it from my side. My voice is almost going. I'll just stop the recording if that's